Order, order. Sir Andrew Mitchell to move the motion.
Dr Morrison, I beg to move that this House has considered a national strategy on accident prevention across the United Kingdom. I want to draw the House's attention today to what can only be described as a silent and spiralling crisis in our country, the devastating human cost of preventable accidents. This is not a new issue, but it is one that is getting worse. And crucially, it is one that is still not given the level of sustained national attention that its scale demands. Too often, people think of accidents as tragic misfortune, but they are often ordinary moments: a fall at home, a collision on the road, an accident at work, a lapse in safety in a familiar environment. Every member of the House here will recognise the pattern. We hear it in our advice surgeries, we receive the letters, we take the calls, we meet parents who have lost children, spouses who have lost partners, children who have lost a parent in circumstances that are sudden, awful and preventable. Towards the end of last year, Dr Morrison, following 2 road fatalities in our community in the royal town of Sutton Coldfield, over the course of a week, and the recent drowning of a teenager in Sutton Park, I had the most valuable experience of meeting a long-standing resident of Royal Sutton Coldfield, Becky Hickman, who is the Chief Executive Officer of ROSPA, the Royal Society for the Prevention of Accidents, who has championed accident prevention at the national level for over 20 years. Indeed, she is in the gallery today. One of these horrific accidents took place on Friday, the 22nd of August last year, when, tragically, 21-year-old Natasha Thorpe was struck by a car in Brassington Avenue in my constituency and died shortly afterwards. I've had the privilege of getting to know this family a little and joining Natasha's father and members of her family for the installation of a memorial bench that has recently been installed in Sutton Park, overlooking the Blackroot Pool. It is hard, Dr Morrison, to describe the life-changing trauma they have suffered, but they are not alone. Now, I should be clear that ROSPA and I welcome the DFT's new road safety strategy, but it is a small part of a much bigger issue and strategy. Road traffic accidents are sadly not isolated events, and nor do accidental deaths and injuries only happen on the roads. Tragedies can occur at home, at work, and indeed when out in open spaces. I will give way, yes.
I thank the honourable gentleman for giving way. One of the gaps that we consistently see is in water safety, and it's the interventions that are often reactive rather than preventative. Through my work on Sam's Law, following the tragic death of a young boy in a local reservoir to me in Yorkshire, I've been working with organisations such as ROSPA and the Royal Life Saving Society and the Fire and Rescue Services to develop a clear risk-based approach for water safety, including guidance on when and how life-saving equipment should be provided. Does the honourable member agree that a national accident prevention strategy must bring together those kinds of organisations who have that experience and that knowledge to make sure that those sorts of incidents never happen again?
Yes, I'm extremely grateful to the honourable gentleman for making that intervention, and as you will see as I develop my speech, I very much agree with him. In Birmingham, we have the 7th highest number of accidental deaths in England. Each year, more than 550 families in our city lose a loved one due to a preventable accident. That is more than 1 death every single day. Across the West Midlands, over 2,000 people die annually due to accidents, the equivalent of wiping out a small village year after year. Nationally, we have seen an 8% rise in accidental death rates and a 3% increase in hospital admissions in just 1 year. Over the past decade, accidental death rates have risen by over 40%. That is not a blip, not a statistical anomaly, and not a short-term fluctuation. It is a serious problem that has been brushed under the carpet for too long. There is also a wider national cost to this issue. Accidents place a significant and growing burden on the National Health Service. Every preventable injury that results in an emergency admission adds pressure to already stretched A&E departments, ambulance services and hospital wards. We are talking, Dr. Morrison, about millions of bed days every year linked to accident-related admissions. Accidents now are believed to cost us at least £6 billion annually in NHS medical care. The impact on NHS staff is also profound. Doctors, nurses, paramedics and support staff are dealing daily with injuries and emergencies that, in many cases, could have been prevented. That is not only a clinical challenge, but also a human one, placing additional strain on a workforce that is already under great pressure. And the burden extends across the economy. When people are injured, they are often unable to work, sometimes temporarily, sometimes permanently. Families lose income, employers lose skilled workers, productivity falls. The country loses millions of working days each year due to accident-related absence. The combined cost to UK business is now estimated at about £6 billion every year. Taken together, this represents a hidden but substantial cost to the country, to our health service, to our economy, and to our public finances. And the truth is, Dr. Morrison, that we can do better, and indeed we have done better before. We know what works: safer homes, stronger product standards, effective public awareness campaigns, improved design of public spaces, better data collection, and coordinated action across government and local agencies. I will.
Member for giving right honourable member for giving way. He mentions data there. 28-year-old Benedict Solly was killed on the A37 near Cernavas at a notorious accident hotspot, and there were plenty of interventions that local residents have been calling on to make that junction safe. But part of the problem is the decision on whether or not to make an intervention at that junction is based on historical data, which is only recording actual collisions, not near misses, not near accidents avoided, all of those other things. Does he agree with me that actually we need a wider data set in order to inform the interventions that we make to avoid the fatal accidents occurring?
Well, the honourable gentleman makes an extremely good point, and he adds that particular tragedy to the tragedies which I have already mentioned. And of course, he is right that with modern technology racing ahead in so many ways, our data should be better and more effective at informing the decisions that are made, and he made that point with great eloquence. Yet what Dr. Morrison is currently lacking is a clear, coherent and sustained national strategy to bring these efforts together. At present, responsibility for accident prevention is fragmented across multiple departments: health, transport, housing, education and others. The result is a system where responsibility is dispersed, coordination is inconsistent, and prevention too often falls between institutional gaps. And that is why I believe there is now a compelling case for a national accident prevention strategy. Such a strategy would have benefits across the whole of government, be it safer roads for the Department of Transport, reduced pressure on the National Health Service for Department of Health and Social Care, less spending on benefits for people unable to work due to accidents for the Department for Work and Pensions, and higher productivity for the Treasury. As such, a national accident prevention strategy must be led by the Cabinet Office, which has the oversight necessary to set cross-government priorities and coordinate and align the activities of different departments to achieve them. And Becky Hickman and Rosper should be asked to produce a report for the government on what such a strategy might look like. It should, in my view, be based on a few clear principles. First, ministerial leadership at the centre of government, ensuring accountability and direction. Second, a clear focus on prevention rather than simply reacting after harm has occurred, the very point that the honourable gentleman was making just a moment ago. Of course.
I thank the right honourable gentleman for giving way. Rural communities face unique challenges when it comes to prevention and addressing accidents. We are more isolated, have terrible signal, roads more likely to lead to crashes, and agriculture is Britain's most dangerous industry. Does the honourable member agree that any national accident prevention strategies must focus on reality and be matched by proper investment in public health funding, which areas like Somerset have always lost out on?
Well, I think I do agree with what the honourable gentleman has said, except I wouldn't wish to make a particular exceptional case for the countryside. I think this affects all parts of our country. And as he will know, the royal town of Sutton Coldfield is an ancient royal town, not therefore part of the countryside as such, although we do have in the royal town of Sutton Coldfield the biggest municipal park in Europe, so we at least doff our caps to the issue of rurality. Now, I was listing the number of clear principles, Dr. Morrison, that I thought should inform a report of the type I have described, and I mentioned two. The third is indeed the better use of data so that we understand where risks are emerging, where interventions are needed, and whether policies are working. So I suspect I will carry the two honourable gentlemen who have intervened on me on that point. Fourth, a serious focus on those most at risk of accidental harm. And fifth, and finally, a sustained approach to public education and awareness so that safety is embedded across the life course from childhood through to older age. I want to return, Dr. Morrison, briefly to the human reality behind all of this. A child walking to school, a friend cooking a meal at home, a parent swimming in the sea on holiday, ordinary stories with tragic endings. We all, as members of Parliament, know of searingly heartbreaking, awful occurrences like poor Natasha's death. We have the evidence, we have the tools, we have the example of other countries such as Australia and Finland, where coordinated government accident prevention strategies are already in place. What is missing in the UK is the sustained national leadership to bring them together. We should not accept a situation in which tens of thousands of lives are lost each year to preventable accidents. We should not accept a system that is fragmented when lives depend on coordination. And we should not accept avoidable suffering when the knowledge, tools, and capacity to prevent it already exist. Because ultimately, this is not just about policy. It is about whether we are prepared to act on what we already know, that far too many lives are being lost unnecessarily, and that this does not have to be the case. Above all, Dr. Morrison, all these are non-party political points. There is no party politics in this. I'm appealing to the good sense and experience of all members of this House in the hope that together we can support the government in driving this agenda forward with vigour.